Hello, I've got Dr. Elena Rios, who's the president and CEO of the National Hispanic Medical Association with us today. Welcome to the Takedown. Got a couple of questions for you, Dr. Rios. Would love to know what motivates you and the National Hispanic Medical Association to get involved in the fight against tobacco?
Well, the National Hispanic Medical Association was established really to improve the health of Hispanics and other underserved. And we know how bad tobacco is, smoking is for causing so many diseases like, respiratory diseases, cancer, heart disease, diabetes. And I think to have a healthy lifestyle, you really do need to stop smoking. And that's really what drives us in this fight.
I'm glad you're in it with us. We know the tobacco industry has targeted the Hispanic community and youth for decades, like they have with other groups. Would you mind telling us about the impact, the specific impact that you have experienced then on Hispanic health?
They really targeted our community events, cultural events, where families and generations of multi-generations of people come together to celebrate Cinco de Mayo and the 16th of September in the Mexican American community in Los Angeles, where I come from. And I think it's just been, really just nonstop trying to include a sense of assimilation into Western society, that it would be cool to smoke.
As you know, the tobacco industry has a new way to addict those that use the products, and vaping really remains extremely popular among young people. How is NHMA responding to the youth e-cigarette epidemic, and what needs to be done to end it?
Well, again, the National Hispanic Medical Association has actually been supported by the Aetna Foundation for our campaign that we call Stop Vaping campaign. We have a website with www.nhmamd.org with lots of tools and resources, videos appealing to young people to educate. I think the most important role we have is to educate through our spokespersons, through our influencers, especially through social media. Given COVID-19, we had planned to have doctors go to schools and start talking to young people in middle school and high school. But we had to change our campaign effort to be more of a social media campaign. And I have to say, we've been very successful in reaching lots of young people, and even through TikTok and Snapchat, which I know nothing about. But I think that we've tried to get the message out of not to start. If you have not started, don't start. And if you have, to stop.
Speaking of cigarettes, in recent years, the use of menthol cigarettes has increased among Hispanic smokers. What are your thoughts about the FDA's decision to ban menthol cigarettes?
Menthol has also been shown to be more addictive. And I think that it's so important that FDA do this and make this big announcement.
How important is it to develop tailored, culturally sensitive approaches to tobacco prevention and cessation efforts? You talked about, reaching into schools and whatnot, and your whole plan.
There are differences in our cultures, and it is important to realize that the messaging needs to include the culture, and especially the family celebrations as part of that cultural backdrop. And I think it's important to realize that there are different types of music, different types of food. Among the, again, the Caribbean, Puerto Rican Cubans versus the Southwest Mexican Americans. And then we have Latin American people who come from different countries, and they all have a little bit of differences, but at the same time, they respond to their strong cultural backgrounds, their strong a sense of connection to the country of origin that they come from. And the other thing I have to say is that it's important to have messaging in Spanish, because so many, especially the first-time immigrants, first generation, second generation, keep their Spanish language because they're so isolated from the rest of the community. And there's so much of a strong Spanish communications networks in this country, from TV to radio, especially.
You're talking about the gathering of family. Could you tell us a bit more about the importance of community and family as it takes to help someone quit? You know, the individual, the family, the health provider, the community. What can you share a bit more about cessation and the awareness there from your point of view?
Well, I think it's very important among the Latino community to have family involved in quitting. Respecting your family and respecting yourself is very important, to have a healthy lifestyle and not to feel as stressed as everyone is that's working in labor jobs or unskilled jobs, as many Hispanics are. And also feeling a sense of isolation, maybe being away from your country of origin, if you're an immigrant, first generation immigrant. But as people get assimilated, there's more of a sense of wanting to have respect for your family and be able to feel good about yourself. And I think that's why it's so important to have messages about how smoking is detrimental to your health, and you will not be able to be a functional and a part of your family. Smoking does create horrible diseases, diabetes and heart disease, who much younger in younger ages than if you don't smoke. And for family members who want to take care of their family, want to take care of their aging parents or their younger grandchildren, want to be able to survive in a good, healthy, and especially mentally, want to be able to have a healthy lifestyle with their families. So I think that's important. And I do have to say that the government has put together some great promotional materials and educational materials about quitting on their website called smokefree.gov, and it is in Spanish, espanol.smokefree.gov. And I think that from the National Cancer Institute and National Institutes of Health. And I think that it's very important to share that information among all of our communities, and especially those who understand the importance of healthy lifestyle.
Dr. Rios, thank you so much for sharing today and the resources that you've given to help people quit. Thank you and the National Hispanic Medical Association for all that you do in supporting the community. Thanks again.